So we said about thyroxine and insulin regulates the tissue accretion and differentiation. So, and both these hormones are required for the normal growth and development, particularly during late gestation. So these both hormones are particularly needed for in late gestation period. Okay, and glucocorticoids also play an important role. Glucocorticoids also plays an important role primarily towards the end of gestation. So, and also play primarily towards the end of gestation and influence the prepartum maturation of organs such as liver, lungs and gastrointestinal tract. What? Prepartum maturation of organs. So these glucocorticoids also influence prepartum maturation of organs. Prepartum maturation of organs like liver, lungs, GIT, gastrointestinal tract, GIT, etc. And prepartum maturation of liver, lungs, GIT. Okay. And growth hormone, though present in high levels in fetus and is not known to influence fetal growth. Growth hormone, though present in high levels in fetus, is not known to influence fetal growth. And what are the fetal growth factors? These are the fetal hormones. Some of them I have given, and fetal growth factors. A large number of growth factors are synthesized locally in fetal tissues. So these growth factors are synthesized locally in fetal tissues. Synthesized locally in fetal tissues. These fetal growth factors synthesized locally in fetal tissues and act principally by autocrine and paracrine mechanisms. So how they act principally by autocrine and paracrine mechanism. Autocrine and paracrine mechanisms. They act principally by autocrine and paracrine mechanisms, and their prime effect is on cell division. And though they also influence other aspects of tissue growth. These fetal growth factors also influence other aspects of tissue growth, and these factors can be both growth promoting or inhibitory, and these fetal growth factors may be promoting or inhibitory. Promoting or inhibitory. Okay, the insulin-like growth factor, like IGF, insulin-like growth factor, IGF. We call it as IGF-1 and IGF-2. This IGF-1 and IGF-2, insulin-like growth factor, insulin growth factor 1 and insulin growth factor 2, are among the most extensively studied fetal growth factors. These are the most extensively seen fetal growth factors. And other growth promoting factors include epidermal growth factor. Other fetal growth factors are epidermal growth factor, EGF. So the transforming growth factor also there. Transforming growth factor alpha, and platelet divided growth factor also there. Platelet divided growth factor, I have given here in short forms PDGF, platelet dividing growth factor. TGF in full form, it is transforming growth factor, and AEGF epidermal, and PDGF is platelet divider, growth factor. And fibroblast growth factor is also there. Fibroblast growth factor. And nerve growth factor. Fibroblast. Nerve. These are the growth factors. Nerve growth factor also there, and inhibitory factors include. These are the promoting growth factors, and there are several inhibitory factors include TGF beta, transforming growth factor beta. Alpha is promoting and beta is inhibitor factor, and other inhibitory factors like Mullerian inhibitory substance and inhibin or activin family of proteins are the inhibiting growth factors in fetus. And inhibitory factors I told already: TGF, transforming growth factor beta, Mullerian inhibitory substance, and inhibin or activin family of proteins. And these also the inhibitory factors. And there are placental factors also there. There are several placental growth factors of the fetus, fetal growth factors. Okay, placental factors. As in most species, fetal weight directly correlates with the placental weight at term. Fetal weight directly correlates with the placental weight. Fetal weight directly correlates with placental correlate with placental weight. And fetal growth is highly dependent on the structure and functional integrity of the placenta. Okay, fetal growth is highly depend on the structural and functional integrity of the placenta. And with advancing gestation, with increasing the years of gestation, months of gestation, the weight of the placenta increases to cater to increased needs of the baby. So this weight of placenta increases for providing needs of the baby. Okay, and there are most functional and structural changes in the placenta that make this adaptation more efficient. There are important functional and structural changes in the placenta that makes this adaptation more efficient. So the total villus surface area increases. Total villus surface area increases in the placenta, and the diffusion distance decreases. Total villus surface area of the placenta increases, the diffusion distance decreases, and the fetal capillaries dilate, and the resistance in fetal placenta vasculature falls. Okay, so there will be easier diffusion distance decreases, fetal capillaries dilate, and there will be easier diffusion of the fluids, and this positive remodeling facilitates or helps. This positive remodeling helps nutrient transport across the placenta. So that's the matter in placental factors. So next we can move to maternal factors.